Hello, and welcome to Surgery Squad's virtual enucleation surgery. I'm Dr. Jeff, and I will be guiding you through this eyeball removal procedure today. Enucleation surgery requires the removal of the whole eyeball. However, the remaining orbital contents, including eye muscles, stay intact. Enucleation is considered a surgery of last resort. Typically, recipients of this surgery have large eye tumors, severe eye trauma, or end-stage eye diseases, such as glaucoma or diabetes. After enucleation surgery, there are two elements that are needed: an implant to keep the volume of the eye socket intact, and the addition of an artificial eye. Although there are no alternatives to eyeball removal, enucleation is considered a safe procedure, with patients rarely experiencing major complications. Now that you understand the need for eyeball removal, let's put on our gloves and remove one. Today, our patient is a 30-year-old man who has severe pain in his blind left eye, brought on by extensive radiation for a large ocular tumor a few years earlier. It was determined he had no other option and has been recommended for surgery. Let's begin. First, we need to administer a general anesthesia intravenously. This will put your patient to sleep for the procedure. We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please. Great. Now you need to apply drops of anesthetic to the eye. Great. Now you can begin the removal of the eyeball. In order to access the ocular cavity, you will need to cut the two outer coverings of the eye. You will need blunt conjunctiva scissors to do this. Take the scissors and carefully cut across the layers so you can access the ocular cavity. Perfect. Now you can access the muscles that hold and move the eyeball. See those muscles attached to the eyeball? Those are the rectus muscles. You'll need to detach those in order to reach the optic nerve. Good job! Now you can scoop the eyeball out enough to reach the superior oblique muscle and optic nerve. There they are. Take the enucleation scissors and cut the muscle and the optic nerve. Now the eyeball is free. You'll need to keep it for prosthetic sizing. Move the eyeball to the surgical tray. There is a lot of bleeding. You need to gently cauterize the optic nerve. Use the cauterizer and seal up the nerve. Fantastic job! Before we finish the surgery, you need to decide if you want to implant a prosthetic eye now or leave the cavity empty. Good call. The patient has no other medical issues that would prevent you from inserting the implant now. Let's look at the eyeball you removed. You need to choose an implant that is similar in size to fill the ocular cavity. Perfect size. Let's add the implant. Use the orbital implant introducer to hold the implant and insert it into the patient's ocular cavity. Perfect fit. For the best mobility of the implant, you used a porous Proplast implant. This means you can suture the extraocular muscles to the implant, and it will move similar to a real eye. It's time to suture those muscles to the implant. Take the suture needle and attach the muscles to the implant. Good job! Now the muscles will be viable for when the patient decides to exchange his ocular implant for a more lifelike ocular prosthesis. Time to close the Tenon's capsule and conjunctiva. Take the suture needle again to stitch the Tenon's capsule closed. Fantastic job! Enucleation is typically an outpatient surgery. Once our patient wakes up, he will be able to go home and rest. Patients will experience a headache for typically 24 to 36 hours after surgery. This can be relieved with 2 over-the-counter pain relievers taken every 4 hours. In addition, depending on patient status, they will be prescribed oral antibiotics or steroids for infection. Regardless of if the patient received an implant or not, a pressure dressing will be placed on the ocular cavity and maintained for at least 4 to 6 days. At this time, the patient will be evaluated. Finally, once the pressure dressing comes off, the patient will need to apply topical antibiotics 4 times a day for 4 weeks. Over the next few months, our patient's removed eye will be used to help find and size an artificial eye that should come close to matching his real eye. Now that our patient has had enucleation surgery, he will need to see his ophthalmologist yearly for the rest of his life. And that's how we remove an eyeball. You did a great job today. While you're here, try your hand at one of our other surgeries here at SurgerySquad.com.
Check out our other videos on SurgerySquad.com.